Hey guys, Seventh Moose here. So I want to get a little bit of house cleaning out of the way before I get into this video. I've been kind of working on my audio and my video quality some. I'm hoping that it comes out like it looks like I care. Been focusing more on this because I'm feel like I'm finally at a point with my job and everything else where I can actually take the time to reliably do my weekly videos and reliably stream twice a week. Twitch.com// Seventh Boost from the left. I stream every Tuesday and Thursday. Shameless self plug there. But really, what I want to ask you guys is let me know in the comments or in the chat on Twitch if you have any suggestions, if you like the changes, if you don't like it. Let me know. I'm still a little bit new in this. I love doing audio and video engineering, fiddling with settings and stuff like that. I will be working on getting a better camera, working on getting some better lighting in here. I've already done some of that work, but I'm not quite 100% yet. So, again, as someone a little bit new to the video side of things, especially, let me know what you guys think. Don't just hate me because of my politics. That being said, today, do you want to talk a little bit about masks and the COVID vaccine? And I guess this is going to be things that are going to get me banned off YouTube, part two. All right, first off, I do want to just put my position out there and put a disclaimer out there to all the YouTube, Twitch, Twitter, whatever moderators. I'm just talking about my opinion. All right. And that it is just that. It's not medical advice. If you are taking medical advice from a guy who looks like a cult leader from the early 80s, I honestly don't think I can help you at that point. You're kind of, yeah, what can I do? If you disagree with me, let me know in the comments because I'm open to changing my mind. This is just, what I've been thinking about and some things, and I'm kind of getting tired of being afraid to say it. So I just want to get it out there, get the debate going, and see how it goes. Now that that's out of the way, I do want to say my policy position here is that I am actually pro-mask, generally speaking, anti-vaccine, generally speaking, and anti-government telling me what to do, generally speaking. And I know that that is a bit of a dichotomous position, even though I think that the majority of Americans are well in line with that sort of mentality. I still don't think enough people talk about why and how they are of that opinion. So, starting off with masks, I know when this whole COVID thing first started, I probably took it a little bit less seriously than I maybe could have or should have, but I still decided not to quit a job that I currently hated just so that I would have the health insurance in case I did catch it. So, I still took it a little bit seriously, but maybe not as much as I could have or should have. But I didn't really have a problem wearing the mask. What I had a problem with was Dr. Fauci coming out and saying that he doesn't want to see people wearing masks when this whole thing first came out, that it didn't make a lot of sense for people to wear a mask. Now, I understand to a point that it almost made sense to say that. We were having a shortage. Having a stockpile of everything that we may need in case of an emergency is unrealistic, both financially and from a physical storage standpoint. So I feel like he said that more as a way to ensure that there wasn't a mask panic, not a mass panic, a mass mask panic maybe, where the medical professionals were unable to get masks. And to be fair, I feel like they probably needed it a whole lot more than you or I did during that time. So I'm not going to say I'm going to give it a pass, but I'm not going to give it a massive negative mark because I don't think that Fauci was doing this specifically to hurt American people or to damage something or whatever. I think that he did it out of an interest of preservation for the general population. But I still don't like it because it's the government lying and potentially causing people to die. In the same token, maybe saving some lives, but it's still a lie because as soon as I heard that, that's what I thought. He's just saying that so that there's not a mass mask panic. But my opinion on masks has stayed actually surprisingly relatively consistent throughout the entirety of the pandemic. I felt like, and still do, that they work. I didn't think that they were really going to work well outside. I thought they made some sense inside, but again, maybe somewhere between like 20 to 30% effective. The other thing that I knew, say knew, but learned, studied before the pandemic even, I knew a little bit about how viruses spread because I'm a crazy prepping psychopath, that you can get a little bit of a virus and have mild symptoms and be fine, or you can get a lot of a non-deadly virus and have major symptoms and not be fine. So I figured wearing a mask might keep some of those particles close by, potentially not spreading it, and thus lessening, key word here, the effect of someone else getting sick. It may not prevent people from getting sick, but it probably would prevent them from getting as sick. So that's kind of where I stood on, and still do stand on, masks, that they're going to work, but outside with UV light and airflow and stuff like that, it's probably not going to make an appreciable difference. Maybe a non-zero number, but very close to zero difference in spread, how bad the symptoms are if someone does catch it, all that other stuff. Next, I want to talk a little bit about why I don't want to take a vaccine. And I know a lot of people are going to get really, really upset, and a big part of it comes down to it's being pushed really hard. And I was considering it before that, but I guess I'm a bit too much of a conspiracy theorist, and I don't like it. And I think that should be my right. Honestly, shouldn't have to get a vaccine. I haven't heard a good argument as to why I should. And until I do, that's my opinion. But I want to get into why I don't think that everybody should ever get A, the same vaccine, and B, there should be at least some people who don't get a vaccine. And now we're going to talk specifically in a theoretical here. And just so no one cuts this, I'm actually going to take off my glasses whenever I talk in theoreticals, just to make sure when someone cuts this clip and I'm not wearing my glasses, those who watch my videos actually know that I'm talking theoretically here. So let's say, I don't know, the Johnson & Johnson vaccine in 10% of people causes infertility. Male, female, doesn't matter. It's just a flat 10%, for whatever reason, seem to become infertile after a year and a half of getting the vaccine. If everyone took the same vaccine that causes this infertility, then we would have a 10% of people who are unable to have children, which would cause some serious social, economical problems in our world. Now, if we have 3 vaccines, which seems like we kind of have maybe 3 to 4, depending on where you are and whatever else, and only one of them has serious long-term effects, the Johnson & Johnson, now you're taking 10% of 1/3. That is a much better number. It would be a hit on social economical issues, but it still wouldn't be that bad by comparison to, actually 10% of the entire population. Lastly, I always think there should be a control group, because what if 5% of people have kidney failure with the AstraZeneca one, and 10% have infertility with the Johnson & Johnson, and then, but those who don't get the vaccine don't have anything. Now we have a control, specifically with the type of vaccine that's been pushed through relatively quickly. Mistakes can and have been made with this type of stuff. I don't want to get too deep into conspiracies, but if you're interested in seeing maybe how things can happen, at least the logic behind it, I did a lot of research into the conspiracy theory that the polio vaccine caused AIDS, and I don't necessarily believe that that's true, but the way that it presented some sort of evidence and the thoughts that it kind of provoked suggested I can see how mistakes can be made and how it can make certain diseases zoonotic, stuff like that. I know that I don't think any of the vaccines were created using any animal tissue or even human tissue. I could be wrong on that last part. So that's not going to be a problem, but you have to understand that medical science is not settled. The science is never settled. In fact, that's the whole point of science, is that we keep on trying to improve. We think we know what's going on. And so the science might be settled on gravity per se, but do we know that that's the only thing that's affecting the keeping people on the earth? We don't, because the science is never going to be settled. Doesn't mean that you don't use what is appreciable and discovered and repeatable to base your opinions on. So if you want to get the vaccine, and you believe that it's the right thing to do based on the science that you've studied, I encourage you to do it because I think that we should have the vast majority of people attempting to get the vaccine, specifically those that are at risk. I don't feel like I am. And I feel like that if I died from COVID or even killed somebody else from COVID, that it would be a very, very low chance. I wouldn't, again, say non zero, but functionally zero, meaning that it's so many decimal points low that it would take longer to say those decimal points than to actually just say functionally zero. Anyway, guys, again, that is just my opinion. We are done talking in theoreticals here. But that is why I'm not going to be getting the vaccine, because that's kind of where I stand on my thoughts and opinions. I really do want to hear from you guys. I don't usually push too hard on a lot of this stuff, but I'm going to this time. Please, 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 please let me know what you think in the comments, because I could be wrong. And if I am, I would very much like to know. And I would like to hear what you guys think about this. And maybe I change my mind. And that's kind of the point of political, social, philosophical debate is it's not just changing someone's mind, but it's exposing yourself to another point of view to change your own mind. So that's the video, guys. Hope you enjoyed. Like, comment, subscribe, something, something, whatever. I don't like doing this self-promotion, but I know that really helps. So I'm going to ask you guys again to comment. And if you liked it, whatever. Anyway, be good to yourselves, especially be good to each other. Have a good day. End of video.